ChatGerry, 5 Fundamental Measures of Cancer Prevention. Number 1357, VMT Sharp 701, September 16, 2025. Gerald C. EclaireMD Foundation. Category: Cancers. Preface. For more than 16 years, my research has shown one truth across diabetes, heart disease, kidney disease, stroke, and cancer: prevention is more powerful than treatment. America has the most advanced medicine in the world, yet life expectancy is only 77 years, far below Japan at 85 and South Korea at 83. Why? Because lifestyle drives health more than technology. No emergency care can erase decades of damage caused by obesity, high blood sugar, poor diet, lack of exercise, stress, and poor sleep. My own stroke in June 2025 taught me this lesson personally. If I had managed my lifestyle strictly in the 1990s instead of waiting until 2010, I might have avoided irreversible calcification in my brain's small vessels. Once damage is embedded, it cannot disappear. As one doctor told me, physicians do not really save lives, they stabilize emergencies. True survival comes from decades of preventive choices. Cancer risk factors. Cancer risk grows slowly, not overnight. Tumors are the result of long-term metabolic and lifestyle stresses. Treatment is costly, painful, and uncertain. In the United States, profit-driven healthcare and administrative complexity push costs to the highest in the world, almost 1/5 of national GDP. Cancer care often devastates poorer families financially as well as medically. To study prevention, I applied my viscoplastic medicine theory, VMT, using my own longitudinal 15 years data on certain biomarkers and primary lifestyle factors. The model measures cumulative cancer risk energy and shows how habits either raise or lower cancer risk. The cancer risk equation uses 5 weighted factors: body weight, 30%, type 2 diabetes, glucose, 25%, food portion size, 20%, walking steps, 15%, stress and sleep, 10%. The results show that, for my case, obesity and glucose control are the 2 most powerful levers for reducing my cancer risk, supported by diet, activity, sleep and stress. What the data show. Long-term trend, 2011 to 2025. My cancer risk index started very high at 163 in 2011. It dropped by 46% by 2016, and by 2025 it stabilized at 73, less than half the original level. Drivers of risk: diabetes, glucose, 25%, and food, 22%, are the strongest contributors, followed by activity, 21%, sleep and stress, 13%, matter 2, weight, 19%, became less influential because I reduced my BMI from 31 in 2011 to 24 in 2025. Turning point: around 2015 to 2016, my cancer risk index fell below 100 and stabilized, showing the effect of lifestyle corrections. Generational context: globally, obesity causes 3.8 to 3.9% of new cancers, while diabetes causes about 2.0%. Many patients have both. In 2025, about 33% of Generation Z men and 30% of women are obese, mainly from fast food habits. These levels are higher than millennials at the same age and are approaching Generation X. For people like me, born in 1947 and now 78 years old, obesity is lower, 25 to 40%, but cancer risk still climbs with age. Key takeaway: cancer risk is not fixed by genetics or aging. It can be sharply reduced by prevention, strict glucose control, smaller food portions, sustained exercise, weight reduction, sufficient sleep, and emotional stress reduction. Prevention is affordable, powerful, and life-saving, far more than treatment. After disease appears. Disclaimer: this content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this study freely, but it must not be edited or republished as your own.